Welcome everyone to Skin Sense here on SSP TV. We're excited to have 3 students on from 3 different local colleges. They are in the PA program. We're with Dr. Stephen Schleicher, and we have students here from King's, right? Misericordia and Arcadia.
Correct. You have a good memory.
And we have our King's College student with us first. It's only your second day, right?
Yep, second day.
All right, I'm going to try your Gabriella. It's Plato-Scante.
Plato-Castante.
I was close.
Yep.
Potato. So thanks for being on the show.
Yeah.
Second day here.
Yeah, very exciting.
I was saying to Doc before we started taping the show that not a lot of students have been in rotation because of COVID. And I know we've had to cancel some of our shows due to so many people with the spike in COVID again. So it's a great opportunity for you to actually be here in rotation.
Right. And we're trying to help out because we feel bad. I mean, rotations are an integral part of what your education is, especially being a PA. And to try to do that virtually is really, really difficult. Yeah. So we're happy to accommodate students and hope we can keep doing so.
I'm sorry that you have to spend so much time with Dr. Schleicher, but okay, anyway.
That was a put down in case anybody didn't pick that up. Okay, we'll spell that out.
And if anyone follows the show for how many years, we were talking, we said you're 22. I think we've been doing the show longer than you've been alive. So if you follow the show, you know that we like to bust each other a lot on here. So tell us a little bit about where you're from. And about the rotation, what do you expect to get out of the program?
Oh, well, yeah. I'm actually from Utica, New York. And this is actually my first rotation in Pennsylvania. So that's kind of exciting. And I'm really excited to do my elective in dermatology just because I grew up loving dermatology, cosmetics, kind of stuff like that.
Utica, of course, is a snow belt. So we're getting
so I'm excited to be here.
Yeah, and tell us about digging out your car.
Yeah,
that's like a delicate.
All the time, even worse than here.
Yeah, my friend's actually a teacher, and she had 2 snow days, Monday and today. So it must be bad there right now, but.
So your rotations, I know that you do different things. How long do you stay on each rotation? And I know that you have a passion for dermatology.
Yep. King's allows us to do 6 weeks. Every 6 weeks we change our rotations, which I'm very fortunate to have 6 weeks because it takes so long to get used to being somewhere and accustomed to how.
So derm's like an elective.
Yep, derm is my only elective.
So there's certain required courses or rotations that they have to take, and derm, obviously it's tougher to get into because probably a lot of people want to go into derm.
Yeah, derm was the #1 requested elective of our class. Yeah.
Really?
Is that because of me or?
I don't know, maybe.
That's funny. So Doc, you've been doing this a long time with having students come in.
Yeah, of course, and it's great because students get to see hands-on procedures. Okay, they get to learn about real common diseases like acne, like eczema, psoriasis. I mean, millions of people have the disease, but there are really rare diseases too that occasionally students will pick up on as well.
They'll see skin cancer, right?
So, skin cancer unfortunately isn't that rare. I mean, there's like 2 million cases every year. But it's very, very important to be able to diagnose it. Certainly, anybody going out in any medical field, if you see someone with a lesion on their face or whatever, you don't want to just walk away. If it looks suspicious, you want to bring that to that patient's attention or person's attention.
Well, I usually ask what's the most interesting thing that you've seen or been here, but you've only been here for 2 days, so I would have to think that being on our show is the most important.
It's probably lunch is the most interesting thing so far.
They do feed you good here.
Yeah.
Because you order out.
But she will see a lot of different things, okay, which is kind of cool. And we actually have a teaching PA who just happens to be out this week and maybe the next week. But so we spend a lot of time with PAs, and teaching is very, very important to us. Okay, and our teaching PA graduated from Misericordia, and a great guy. And it just got overwhelming, especially with 3 students on basically every rotation. So we assigned Zach to basically being the coordinator for teaching. And we have other offices too. So some of our students go to Bethlehem, some of them go to our Leola office, which is great too. So you get to see other offices, meet other providers as well.
Yeah, and I know as as a professor at King's College, I actually get to teach what I do, and I know from what Doc was saying, it's rewarding to give back and to actually, like, he knows how you feel sitting in that seat because many moons ago, Doc was sitting in the same seat.
There used to be a moon back then.
There used to be a moon back then. So it is rewarding to give back and to give that knowledge to the younger generations as yourself.
Yeah, I appreciate it.
So did you see anything interesting? Did you see a lot of patients yet in the last 2 days?
No, I haven't seen any yet, but
Okay.
I'm
She's
looking
getting
forward
ready.
to it. Yeah, I'm ready.
This is her start. If she passes this TV show, we might let her see
Right.
patients.
Okay. So how has it been going to school through this time of our lives during a pandemic? Let's talk about that.
Yeah, it was definitely challenging. My didactic year was basically half virtual, half in person, and I feel like it definitely affected the learning of our class. But I'm hoping to kind of regain that learning and regain the skills that I lacked in didactic year in my clinical year. Just because we were on Zoom, lots of labs got canceled, our cadaver labs got canceled, and
Didactic year means what?
it's basically after our undergrad classes, we go into didactic year having more like clinical-based classes.
Okay, so hands-on.
Yeah.
You also learned a lot, even teaching, and Doc has been doing virtual health for many years.
1999.
Right,
Oh,
and
yeah.
now it's
One of the
become the
pioneers.
norm where
Yeah.
people are using their phones and using Zoom. I mean, I don't know who doesn't know of Zoom calls or Zoom meetings now, but I know for my class, especially through King's, that they've picked up a lot of new skills that is going to be the norm now. I think this is going to be an era where you're going to be doing a lot more things virtually than you are, even though you'll be doing stuff hands-on. Would you say that, Doc?
Yeah,
Even
well, I
in your
actually spoke to
profession?
your class on Zoom
Yeah.
last year. So, yeah, I mean, but, in derm, it's good because it's very visual, so that I get photographs of skin lesions and rashes, and it's almost like being there. So it's almost like an exception for medicine because, where else, you can't see inside the body. So if you're a cardiologist, you need certain instruments, whereas with, us, we just get to look at you.
Yeah. Well, thank you for being on the show. I think you
Yeah.
passed. What do you think?
Yeah, I think she'll pass. Yeah.
King's is a great school. I love being there. I also went to school there myself.
Oh,
so
wow.
good luck to you in your career, and good luck surviving your 6 weeks with Dr. Schleicher
Yeah,
in the
thank you.
office.
She'll have comeback gear on by the end of the rotation. But she'll be okay. She'll do fine.
Maybe one day you'll be working here as a dermatologist.
Hey, you
you never
never
know.
know.
All right, when we come back, we have another student with us, and she is from Misericordia. We're going to talk about her experience here. Stay with us right here on SSP TV. And we're back here on Skin Sense on SSP TV. We have some PA students with us throughout different colleges in the area in northeastern part of the United States. And right now we have another student on with her. We have a student from Misericordia. We have Lexi Zimmerman with us. And, we talked with a King's College student, and this was her second day. This is actually your last day.
It is my last day. He's going to be so upset to lose
And
me.
we get all the
Yeah, she
scoop
made it through.
from you. before
yeah,
you
all the
leave.
dirt. I got it
All
all.
the dirt.
You want to know it? I got it.
Keep your lips sealed. All right, this is very confidential.
I didn't sign
okay?
a HIPAA or a
Don't-
Confidentiality.
confidentiality
Right.
contract.
Don't want to get in trouble, okay?
So tell us where you're from.
Yeah, so I'm originally from Mifflintown, Pennsylvania. It's near State College, very small town. Did my undergrad at St. Joseph's University in Philly, and now doing my graduate school at Misericordia.
How'd that go here with your rotation in Durham?
It's been great. It's been really great to learn from Dr. Schleicher and Zach, the PA who works here. I've been working alongside him a lot too. So they're both very knowledgeable, very great at what they do, and I am blessed to be learning from them.
I think you saw a procedure today with Rebecca.
I performed a
Oh,
procedure
you performed
today.
a procedure?
Yes,
Okay,
I did.
and the patient survived.
Yes, they
Tell us about
survived,
that.
and they look beautiful.
Probably snipped a little skin tip,
What
but that's
did you
okay.
So I took 2 shave biopsies. The patient had 2 moles that he wanted removed. They weren't cosmetically pleasing to him, likely benign, so we just did a little shave biopsy, going to send them off to pathology.
Well, actually, you did some with me also.
I
You did a
did.
great job, by the
Yeah,
way.
thank you.
Yeah, great job.
Now, take us through what does your typical day look like here?
Typical cases like you'd expect, such as rashes, acne, a lot of psoriasis and eczema, but then like you were saying earlier, we do get to see some rare cases, like the epidermolysis bullosa case. I think that was the most interesting case that I saw, a new patient that presented, and then we get some cosmetic cases as well, Botox, fillers.
Oh yeah.
All the goods.
All the good stuff.
Yeah.
Yeah, some people don't realize that you do Botox and fillers, and
we do
it's
it kind
becoming
of everything.
more and more
actually,
popular.
one of our PAs, Rebecca, kind of specializes in the cosmetic procedures, and I've done many. I mean, I used to teach cosmetic procedures before, so they're fun. They're fun. But the greatest need, of course, is for medical.
Yeah.
Okay, so we have the skin cancers, and like you said, psoriasis, eczema. People are itchy. People just don't look good on the outside, and we like to heal these people up.
So when patients come in, they will see the PA students. How do you introduce them, or what happens in the room?
It really depends on the patient. Depends if it's a new patient, if it's a follow-up patient. Okay, many times a new patient who's never been here before, we certainly will send the PA in to take the history. Okay, do an exam. And it's helpful. I mean, it shows the patient that we care even more because we have two people asking questions instead of one. So, and it's great for the students too because they get to practice their skills. Okay, and history taking is very, very important, as is physical exam, as you will attest to.
Yes,
okay?
absolutely.
So, yeah.
So is it what you thought it would be? Derm, is it something you want to do, or is it just part of the rotation?
100%. If there's any employers out there, look at me because I will definitely be hired by you if you choose so.
Okay.
I love dermatology so much.
Talking about self-promotion.
I know. I got a camera in front of me. I might as well.
You should carry a little sign or something. Like they have at airports. Hire me.
Oh my goodness. So derm is your thing?
I love derm. I did a rotation in plastics as well. I loved that as well. I definitely like the medical and cosmetic side combined. I think it's important, like you were saying, to be able to do both, especially on the medical side, like you were talking about with psoriasis. It's not just a skin condition. A lot of it can have a really big impact on a patient's self-esteem, anxiety, all of that as well. So I think it's really beneficial what we do, and I love skin.
And I have to say, PAs are top notch. Okay, it's very, very difficult getting into PA school. Okay, so it's competitive, and the students are great. I mean, I've been taking students now, probably took my first King student maybe 20 years ago.
Right.
Actually, it was Arcadia, which used to be called Beaver, and that's what I had at my office in Philadelphia. But the caliber has just gotten better and better. So it's a tribute to you,
Thank you.
and the other PH students that we have, for sure.
Did you have an interest in skin for any other reason than?
Yeah, my grandma had melanoma when I was little, so that started. She survived, thankfully. But she gets annual skin checks every year, and I was able to go with her one time, and I was so intrigued by the fact that they were looking under what I thought was a little microscope at the time. I was like 10, and were able to really check everything out, and so that was the start of my interest in dermatology, and from there I learned more, loved more about it.
That's awesome. And how have you been with working through the pandemic, going through school in such a competitive area of education?
Yeah, so the start of the pandemic was right at my graduation from undergrad and start of graduate school. So I basically went online for the end of my undergrad, didn't have a graduation, and then still online for the beginning of my grad school. So it was an odd transition, I guess, to say, because I was really ready to jump into the classroom and learn and be hands-on with my classmates. And although we didn't get that experience right away, we did in the spring come back to in-person completely in the classroom, and that was very beneficial. And then all of my clinicals so far have been able to be in person, thankfully, which I know not all schools are able to do right now.
Awesome. So you get a graduation now?
Yes, fingers crossed.
There we go.
Yeah.
All right. Well, thanks for being on the
Thank
show
you
with
for
us.
having me.
Thank you for surviving Dr. Schleicher for 6
And she
weeks.
passed the rotation, which is
Passed the
wonderful.
rotation.
Okay, so
Very
that's good.
All right, we have one more student up, and she is from Arcadia, so stay with us right here on SSP TV. You're watching Skin Sense. We have an interesting show for you today with PA students on from different colleges. We're here at DermDox on SSP TV. Skin Sense, we have one more student with us, and she's from Arcadia College. So it's Vasavi, first name.
Vasavi.
Last name.
Vera Panini. So basically the entire alphabet.
Wow.
Vera Panini. It's like panini bread. That's kind of how I
Okay.
explain it. But Panini. So
Gotcha.
Vera Panini. Yep.
So, and Vasavi was born in India.
I was. Yes.
Okay,
Very
spent
nice.
what, 8 years or so there.
Yeah. Yeah.
Came to the U.S., speaks English better than 99.9% of us. So it's a tribute to her. And actually, I asked her a couple of days ago, were you ever on TV before?
Oh my God.
And she goes, yes. And then I was floored when she told me why. So tell me, it's not America's Most Wanted either. So
What is it?
but-
Yeah, I actually have to explain so
Yeah,
he
you
didn't
gotta
think I
explain.
was on
Yeah.
America's Most Wanted.
Yeah, right.
Well, I guess the backstory to this is it was an unexpected experience. But back when I was an undergraduate, my senior year of school, I was honored to receive this award. Don't like to talk too much about it, but like it was through my favorite professor. It meant a lot to me. It made a lot of difference to me, like just confidence wise and like career path. But what my school did was maybe release a small little article on their like web page about like, here's our student, you won this award. But what really stood out on the article was my age, which
Yeah,
I
it
didn't
was
think
very
about at all. And that was picked up by like local news.
She was the youngest person to graduate her college. Okay. Which,
Really?
Yeah, so.
How old were you? Come on.
I was 19 at the time when I graduated, but
From college.
from college, I was
college,
just
yeah.
I was racing through,
She like
the
skipped
school-
a year of high
school
school.
and
So,
college.
like I said, PA students are really top caliber now. Okay, and this is living proof. Okay,
Yeah.
so that's
thank you,
pretty
thank you.
good. I mean,
Yeah.
You and I have problems with
I was
arithmetic.
going to say he was probably the oldest that graduated
So,
from college, but that's another story.
You actually graduated. Anyway.
Where are you from now? Maryland.
I'm from Salisbury, Maryland. So I guess for those who aren't familiar with where that is, it's close to Ocean City, Maryland.
Oh, yeah.
So if someone visits me, that's where I take them because that's the closest attraction. We're known for like Old Bay and good crabs.
Yeah, no, that's great. And you like dermatology.
I love
Of course.
dermatology.
So what you were on? You were on what psychiatric rotation?
I
Okay.
think 2 rotations ago is I had psychiatry. A lot of my rotations were actually in Delaware, which is where my program is. So Arcadia actually has 2 campuses, one in Glenside, Pennsylvania, and one in Delaware. And that's the one I'm at currently. And so most of my rotations I was lucky enough to have in that area, so at Christiana Care. They've been pretty good experiences, I'd say.
And you're here 2 weeks now in this rotation.
I'm here for a total of 4 weeks, so a little bit shorter than the other schools. But I think the real difference is our program kind of gives you more electives, so they're like shorter rotations, but basically more specialties, I guess, if we could put it that way, which I'm really grateful for actually, because I got to do derm, which is an elective for me, and orthopedic surgery, and I think my next one coming up is urgent care. So getting to do those 3 electives is also good exposure for anyone who wants to do something outside of, like primary care.
I always like to ask students who in their family is in medicine.
Oh, okay.
Because it's always interesting.
Yes.
Because in my family, I was it. Okay, nobody, period, was in medicine. So I was it. But you, your mom.
Yeah,
is-
my mom's a nurse, and I don't think I told you this, but her mom's a nurse.
Okay.
And her mom was also, I think, a nursing assistant.
Oh my
so
gosh.
I kind of did cut the nursing path, but still in medicine.
which
still in
I
medicine.
find it always of interest how people get it. And myself, the people said when I was like 1 year old or 2 years old, I was always interested in biology and medicine. I always wanted to be a doctor. But I have no idea why, so it's just weird.
You were born in that path,
I
and
was
that's
born.
why
Yeah,
I
born to
always-
be wild.
There you go.
Yeah,
You're
he's
definitely
curious,
wild.
Hey, if it wasn't for you thinking about dermatology at 2 years old, what would we do?
Well, yeah. Well, that's true. You guys wouldn't have rotation. That's a good point.
Exactly.
So, yeah, we have to thank my youth, like
Yes.
real youth, when I was running around in
2-year-old
diapers.
doctor.
Your 2-year-old self.
So, amazing.
So what made you go into the medical field? Was it from your being around it? Your
Yeah,
mom as a nurse?
So I think growing up, that exposure I've really had. You know, my mom was a nurse. As a child, I was a pretty sick child. So you know, I got to see firsthand medicine from my mom. She got to take care of me. But on top of that, I think just growing up here, I was able to do a lot of like shadowing and just volunteering at the hospital, just to kind of see if this is what I want to do, because you know it's a big commitment, and I could really tell, especially patient care. I enjoy talking. That I can say about myself, and you know, being able to talk to patients, seeing them feel better, that was something that always kind of gave me that satisfaction. And I know that medicine, you know, you'll see that a lot. So that's kind of the one thing.
So you'll stay in the
that
medical
drove me.
field, in other words.
Yes.
Okay, just checking.
What do you want to do? It's not derm. Or
Oh, I'm totally interested in derm, but I think, well, the way that it's been for me is, you know, I've never kind of had my mind set on a specialty going into PA school. I kind of kept my options open. Derm, when I was doing my didactic year of study, was like one of my favorite topics. So I knew that when I'm doing these rotations, I like definitely want a derm rotation, you know, see how I like it. And I like it so far. No joke. And I've only been here a week, but I'm really enjoying my time here, and I'm hoping to get to see a lot more, hopefully this week and the next coming week.
Right, and it's very practical too, because when you say helping people don't realize that 3 out of every 4 teenagers has acne, okay, and acne can leave scars, and you know, kids, it just affects them, because you already had, you know, psychology or psychiatry rotation, and you know, a lot of things that are visible, like psoriasis, eczema, visible to other people, can really affect the people who have these conditions. So that's one of the things we like to get our students aware of, how it affects people, okay, not only physically, but mentally as well. So, and it's huge, because nobody wants to walk around with pimples when you're, you know, 15, 16 years old.
Right.
And you say,
even when they're older. I mean,
well,
who
even when
wants
they're
to
older,
walk
you see a lot
around
of
with
women
like
who
stuff
are
all
like,
over
Right
you?
about
yeah,
right now.
yeah,
Right.
yeah,
You know,
no,
but
you're absolutely right.
It's something
So-
that's like, you know, to your appearance means something, and it bothers more people than others, but it's still something that you said can affect you. How many patients do the students see throughout the day? Just so people know how busy your office is.
Well, it actually really depends, because now with the COVID resurgence, obviously the patient, you know, counts are lower, because, and of course, cold weather, you know, people aren't coming out. And now we have an unusual circumstance where we have 3 students, you know, instead of 1. A lot of times they'll rotate to the different offices, but we had snow, you know, with weather, it makes it tough. So, but normally, you know, they can see 20, 30 patients a day,
Right.
okay?
Which
So
is good
a lot
for
of
you.
patients. Oh, it's
Yes.
great.
Yes.
The more patients they see, the better, of course.
Very nice. So in your future plans, while we wrap up the show,
Yes. My future plans starting from now, or?
yeah, what do you hope
yeah.
to do?
Honestly, I mean, you know, the heart's in medicine, so I'm going to be in it for a while. But so far, the clinical year has been great, because I guess for anyone, you know, going into PA school or thinking about PA school, that didactic year is the one that hits you hard, from my experience at least. And then clinical year has been great. So what I've kind of done this year is like picking up a little bit of like everything that I like. I'm like, I love talking to patients, I love procedures, I love skin. So hopefully moving forward, I'll try to find something that will really kind of incorporate all of the things that I like. But ideally, you know, I do want to move back home. That's where, you know, it is. But I wouldn't, I guess I wouldn't give up or, you know, leave an opportunity that I really like if it's outside of that,
Very
you know,
nice.
comfort zone.
Well,
So,
good luck
yes.
to you. Maybe you'll be the youngest doctor in
No.
derm. What do you think?
Doogie
All right.
Howser.
Very nice show with our students again from Misericordia, Arcadia, and King's College. And we will
See you next episode.
see you next episode right here on SSP TV.